It's your favorite news and current affairs program reaching you live from TVC News, and I still have in the house Bikio himself, Babajide Kolade Otitoju, and Paul Dada. Following the impending third wave COVID-19 pandemic in Nigeria due to confirmation of the Delta variant, Lagos, Oyo, Rivers, Kaduna, Kano, Plateau, and the Federal Capital Territory, Abuja, have been placed on red alerts by the Presidential Steering Committee on COVID-19. The chairman of the committee and the secretary to the government of the Federation, Boss Mustafa, said the red alert signal is necessary considering outbreak of the Delta variant and rising cases of infections in the country. He also warned Nigerians to be mindful of possible wider spread of the virus as they celebrate Eid-el-Kabir on Tuesday and Wednesday. Hence, the need for multiple entry and exit points, as well as hand washing and temperature checking facilities at Eid-el-Kabir prayer ground. Babajide, this is just a message that the celebration tomorrow should be on a low key. People should avoid this big prayer grounds across the country and these Durbar festivals that they have in places like Kano after the celebration that should be played down. Even though in the southwest here, the Obasikiri Adesina has cancelled the Ojode Oba for this year.
Yes.
It's a yearly thing that they do after the Eid-el-Kabir. So Ojode Oba has been cancelled so that contact will not be there. The Delta variant, very, very stubborn one, and it kills faster than the first and second wave that we've experienced.
Yes, there are many reasons we should be really worried. This variant that originated from the Indians, but the Indians don't want us to call it the Indian variant. And the world had to accept to call it Delta variant because the Indians said they were being stigmatized. But the thing actually has its origin from their country and has killed so many people in that country. We have to be worried. We really have to be worried. For the first time in a long time, America lost more than 1,000 people in one day again. So this COVID-19 has not left the world alone. Anyone who thinks that we have come to the end of it must be a joker. It has not left the world alone. Now, I will advise states that have shot their yes, and this one needs oxygen a lot. So where you are running short of oxygen, you can be sure that this one will kill people because once it attacks you, within a short time, it's done so much damage, you now need oxygen because it attacks the respiratory system. You need oxygen rapidly. That is why once the Indians were short of it, it started killing them like flies. So I will advise states that have shut down their isolation centers that this is the time to begin to reopen them. A lot of these states, this particular one does not discriminate whether you are young or you are old. It comes for you. In fact, there is evidence that more young people have been attacked by this one. And in terms of transmissibility, its own rate of transmission is the highest. So then, apart from that, the infection rate is high. Now we are running out of resources. I said before that a place like Abuja, for example, including the satellite towns and the federal capital itself, Abuja municipal itself, all of the bed spaces available are now up to 30,000. So, and Abuja has a population of 2 million. How do we deal with the situation if the pandemic were to enter Abuja? So, in terms of infrastructure, we are just not there. We cannot deal with this situation. And the cheapest way to deal with it is to obey those safety protocols. As you can see, Nigerians do not even want, there are many Nigerians who still deceive themselves that this thing is a joke, it does not exist. Something that science has shown to us that it exists. that has killed more than 500,000 in America.
Out of
people will
God's
sit here.
Infinite mercy. We don't know how we escaped.
Yes, and our weather, and of course our weather.
And our weather, I don't know, because we don't have the facility to handle this.
Now, the concern is that it is beginning to rise. There is a signal that a lot of us are ignoring. Once you have more than 200 cases in a day, as we have seen now, we are beginning to have more than 200 cases in a day. That is a clear signal, because I don't think that we are even testing enough. It's like we have stopped testing. So if within the limit of the test that you are doing, you are already recording 200 and something cases a day, then we should be worried. We should be worried.
Dada, I don't know. People are leaving Lagos. They are going to, celebrate. And people are even going to, from Abuja, they are going to their stations. At the end of the day, when you see this movement, this is the fastest way to transmit it. If you want to bring it back to Lagos, if you want to take it back to Abuja, from your villages, now, we cannot stop people from going to for the celebration tomorrow. But
only advice.
Just caution. Just caution should be applied.
If we are going to win this war, because it's also a battle, it's a war against COVID-19. We will need the cooperation of people. People need to just reorientate their minds. Before I came here, one of the offices I went to, I was talking about COVID-19, and one young man who should know more, a supposedly enlightened young man was like, I cannot contract it, just like that. That kind of attitude is representative
of the language of faith.
Exactly. What you have.
I cannot.
And he killed. Remember that Cameroon pastor that killed? After he said it did not exist.
I think people need to understand what is going on. Within the first 13 days of July, we had over 1,200 cases. 1,249 cases of COVID-19. The Lagos State Commissioner for Health said that within 4 days, we lost 4 persons in Lagos. That means every day between July 14 and 17, 1 person died of COVID-19. Now, this Delta variant is very serious. It doesn't even give warning sometimes. You may not even have enough, the fact, they can even test you and may not discover it. That's what people are saying. They can even test you and may not discover it. Suddenly, you begin to, gasp for breath. It attacks your lungs, attacks your lungs directly. And then, Jide said we need, oxygen should be administered rapidly. I say it should also be some people need it in abundance. You understand? People need abundance.
Okay, I have a man of God joining us. Pastor Ben is calling us from Lagos. Hello, Pastor.
Hello, good evening, sir. DKO.
What are you telling your members? Are you telling them their body is the temple of God, so they don't need to take the vaccine, or they don't need to be circumspect?
We have to take it, my brother. We have to take it. And I want... Hello,
yes,
hello.
Go on.
Hello, Ayo.
Yes, I can hear you.
Good evening, sir.
Go ahead, please.
I've taken my
you've taken the vaccine?
My own dose.
Oh, good man.
Good, Pastor.
So please, I want to know, sir, the vaccine, can you prevent... I'm hearing you.
Okay. What's your question?
So the vaccine...
Let's try and call back.
So I want to know, the vaccine, does it prevent this new Delta pandemic?
No.
It's a very dicey thing. This is very stubborn.
There is evidence that the fact that you have been
vaccinated twice.
Vaccinated does not mean you can't be infected. In fact, the World Health Organization has advised people to still continue to wear their mask and respect all those safety protocols put in place.
Non-pharmaceutical
So the fact that you have been vaccinated is no license to continue to do things that they told us not to be doing.
Honestly.
Go into huge crowds unprotected in any way.
The vaccination is just to reduce the fatality.
Now, the vaccination may not make you fall sick, but you can contract it and you can transmit it.
Yes.
You can, because people who have been vaccinated, even outside of Nigeria, had been tested and they were found to have contracted it in spite of the vaccine. So now you may not fall sick, but you are in position to infect someone, which is bad enough. That's why they are saying continue to use your mask even after the vaccination, and wash your hands.
We don't even have up to 1% of the population that is vaccinated yet.
Yes. I was just like a drop in the mighty ocean, the number of people that...
because not a lot of the states are not doing enough. Now that we have, I think Lagos was doing its best. You know, Lagos was doing its best.
Everywhere, healthcare centers.
But we're not even talking about vaccination. Okay. Even tests. Tests are crucial. You need to test your people to know whether they need any form of intervention. We are not testing enough. In some cases, we are not even testing at all. So people will contract it without knowing. We have to democratize even testing. Make tests easily.
They won't
make tests easy.
To a testing center. See, Ayo, if we are going to, I keep saying this thing, if we are going to actually win this thing, if we are going to convince our people, we need to engage with certain stakeholders. For example, this the commercial transport operators, they listen to their
they're already packing people like
they listen to their union escorts more than government. You understand what I'm saying? If government says, if government says, don't take more than 3 passengers per, is it per?
That will be title.
For example, no, the people that can implement that, people that can implement that,
and their leaders.
Are their leaders. I love what that pastor said. For example, engage some of these religious leaders, because some of the things some of them say is very funny, and people listen to their pastors. More than government.
Yes. Assistant gods.
There are pastors who will tell you that COVID-19 cannot affect you. You are covered by the blood of Jesus and all sorts.
It's just because they want to be seeing crowds in church. Exactly. It's just as simple as that. It's not.
What do we stand to gain by all this?
No, don't forget that self-interest is the driver of many of man's actions.
But they have electronic means of collecting tithe and whatever they
want. No, they are not convinced that will deliver the maximum potential.
They go outside for checkup. They go outside. They do checkup. We know people that they sneak out of the country. They will check up. They will do everything. They come back to Nigeria.
Some people have even gone outside Nigeria to get vaccinated.
If you are not personally persuaded,
so you can't come back to tell your members that.
Now you can't go to certain countries now unless you are vaccinated. So for these people who junket all over the place, do you think they will not get vaccinated?
No, they will get vaccinated.
They will get vaccinated. Why deceiving their congregation that it's not necessary?
Guys calling us from Abuja to get that barcode.
Yes, good evening, gentlemen.
Good evening, Benga.
My name is Benga. I'm calling from Abuja.
All right, go ahead.
Yes, I want to comment on the officer that was able to escape.
Your flight lieutenant Abayo.
Yes. In fact, I want to congratulate him that he's supposed to be given an award, and such brilliant and professional way he escaped.
Yes.
This shows that we have well-trained personnel.
Of course.
Show their skill and whatever at any battle. And also, this also shows that those who are saying that the president is treating the bandits with key gloves now know that these people are being bombarded and being killed. That not that the president is because they are from social area, he will pursue this one in south, in that area, they are being killed and they are being pampered. No, they are being killed 100 every day. And that shows that our government, the government body should put more effort, because as Gide has said, if the security did not disrupt it before it cannot end.
Thank you. Thank you, Benga from Abuja. So ultimately, we just want people to be careful.
Yes.
In the next 48 hours, before you come back to work.
So once you start seeing 200 and something cases, we are moving closer and closer back to how things used to be. And vigilance is the key. Then those countries, people coming from those countries, Brazil, South Africa, India, we have to be careful. Governor Sanwo-Olu said 18% of travelers who came into our country between May 8 and July 7 refused to subject themselves to safety protocols, that they dropped fake addresses and fake names. So fake phone numbers. So they cannot track them.
That's wicked.
And subject wicked people. Wicked people. And these same people, you see them, they will go to mosque to pray. They will go to church to pray and be behaving like they love God.
That's what I'm talking about.
They behave like.
I'm talking about personal persuasion. If you are persuaded that this thing is very dangerous.
No, people coming from abroad, no. The things that people come to our country to do, they dare not do in those cenacles.
They can't.
Look at those of them, even when we had curfew, they were arrested inside the nightclubs. It's a good thing that some of them missed their flight because they were supposed to go back. Some of them missed their flight, you know. You can't do it. They can't tell you that there's curfew in the UK or this on Italy, and then you refused. It is here that people think that they can get away with blue murder. So people who are based abroad, you can't come to our country, start misbehaving, trying to take us back to the Stone Age, whereas you are the one who would first criticize the government.
Yes.
I mean, it makes no sense. But you people want to come here and behave like yes.
We were all arrested.
Some of them are based abroad. They can't do it over there. You are coming to spoil your own country. When you get back there, you respect all the laws.
Odumosu paraded them.
And we need more of this.
Common criminals.
Let's have this more of this parade.
Look at them.
They will not learn or change. See this one.
This one walking around with ordinary neka.